Smoking cigarettes, vaping, and even smoking cannabis can wreak havoc on your arteries. Hello, I'm Kimmy Nicholas. Welcome to the Heart of Innovation. Dr. John Phillips is off saving the piggies. I'm going to be joined today by Dr. Peter Farrugia, an interventional cardiologist. He is going to give us the lowdown on how smoking, how, whether it's cigarettes or whether it's cannabis, how they damage your arteries. We're also joined by Douglas and Becca. They run our smoking cessation group that's free to patients every Monday. And we're going to tell you at the end of the show how you can get involved in that if you need some help to quit smoking. But first, hello, 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 Dr. Farrugia. Thank you for joining us. We really appreciate it.
Oh, thank you very much for having me. Greetings from ice cold New Jersey,
You
where we're
guys
in the
got
middle
the
of
ice storm.
the storm of the century. We've got about a foot of snow with lots of ice, so it's been fun here.
So, why is this topic so important to you? Why is this critical to spend an entire hour? I'm sure if we had more time, you would say, I would spend the whole day talking about the importance
And a
of
lot of
quitting.
times, this is what I do. This is what I'm passionate about. Right, trying to help people figure out what they have to do to help themselves. If I told you drinking this liquid 20 times a day was going to be responsible for you dying or losing limbs or losing the ability to truly live and be alive, you would want to know. You would want to understand the impact of that. And this is what we're talking about with smoking. And it's not just smoking, it's any form of nicotine getting into your body is really breaking everything down and leading to so many different problems. And it's like banging my head against the wall on a daily basis when I'm talking to smokers, and I just want to drag them kicking and screaming to my lab to show them this is what a foot looks like when you have no circulation. Right, this is what happens. Are you prepared to lose your foot? Are you prepared to have an amputation above the ankle? Right, on the flip side, again, I'm an interventional cardiologist, so I don't just talk about PAD, we talk about heart disease. People used to say in the 80s and 90s, but doc, I have to die of something, it doesn't matter. The problem is now, today, you don't die from having a heart attack anymore because people like me and teams around the country are racing in to save your life. But then you have heart failure, and now you're drowning to death over the course of 10, 20 years. And that's more miserable than smoking, to be very honest. So this is something I'm very passionate about. And I'm going to say some truths that are not going to make everybody happy, but that doesn't make it any less true. Sometimes you need to be confronted with the truth to understand what needs to change and to understand that you are in control.
Right. It used to be in the CDC, Centers for Disease Control, focused on lung cancer as your biggest risk with smoking. And they never really talked about cardiovascular disease risk. They started to, and now it's interesting. They're just starting to talk about peripheral artery disease, that poor circulation in the legs that is caused by smoking. And they actually have commercials that are out there. And that must be music to your ears to finally have their support out there to what you've been saying for so long.
And what's shocking is, again, as you said, why is it taking this long? It shouldn't. There's no reason. The utilization of any nicotine products, however you're getting it in, yeah, I understand the risk of lung cancer. This is what I say to people all the time, which may catch them right. I'm an interventional cardiologist. You're not seeing me to care for lung disease, lung cancer. All I know is I like to breathe on my own. I have a vowel at the end of my name, which means I like to eat my own food, but I don't really care about oropharyngeal cancer, which is also a risk of tobacco smoking, right? What I do care about and what I've poured my entire life into is cardiovascular disease. So both coronary disease, meaning disease of the arteries that supply your heart, and peripheral arterial disease, which goes for anything from your carotid arteries, which will result in a stroke, to your legs and your feet, resulting in severe limb ischemia or non-healing ulcerations or gangrene. And for any of the men out there listening, one of the first signs of PAD, and I hate to lead with this, is erectile dysfunction. right? Because apparently you need good arterial flow to
Yep.
get to work. And if you don't, that's the first sign of significant PAD.
And I want to bring this in now that you've said that and you have everyone's attention, because Science Direct had a study that came out that showed that they're seeing an increase in patients that have advanced stage PAD, known as critical limb ischemia, between the ages of 18 and 27, presenting in the emergency rooms on deck for amputation. One of them is diabetes, but number two, guess what it is? Vaping and cannabis smoking.
Which is wild. You know, the whole concept behind vaping was it's not going to cause the same problems as smoking a cigarette is, or smoking a cigar. Problem is, it's going to, because no matter what, at the end of the day, you're still getting nicotine into your bloodstream, right? I say this all the time with nicotine, no matter how you get it in. Okay, and again, check this off, because this is going to be one of the times I'm going to make a lot of people not happy with me. But smoking cigarettes, smoking cigars, okay, using the patch, using the pill, chewing the gum, poofing, it's a real thing. Don't Google it, okay? No matter how you get nicotine into your bloodstream, the minute it hits, you are invoking serious damage to every artery in your body. You're increasing the probability of platelets clumping together, forming a clot, wherever that may be. So it's horrible no matter how you get it in. And there's no other way of explaining it.
So, speaking of explaining it, I wanted to, before we get into the basics here, Douglas, when it comes to you and Becca run our smoking cessation group during the week, are doctors explaining this to patients, about the damage that smoking can do? And how are they explaining that they need to quit for PAD?
That's a good question, because for me personally, the doctor just said stop smoking, and that was it. And that's what we typically hear. Just, you got to stop. You got to stop smoking. Stop nicotine. Stop all this. Just stop. And then, all right, see you later. And that's what we get. So we end up Googling with the patches and all the other stuff, and the insanity of trying to figure out how to stop.
Mhm.
And I love his explanation about the fact that we need that further information. And
Yeah.
sometimes we need to hear it. I'm going to say this, sometimes we need to hear the blunt truth about
I
smoking, what it
and
does.
Doug, to follow up with what you're saying, I completely agree. I don't think doctors spend enough time on this. The reason is they don't have enough time on this. Okay, this is not a political statement. This is just the honest truth. The medical system that we live in now is what we, the people, voted for. Big health has taken over the majority of practices everywhere, which means a follow-up appointment, you only get 5 minutes in a room with a physician, which is not what it's meant to be, right? Which is why physicians don't have enough time to explain. And the truth is over time, there's only so many times you can hit your head against the wall before you recognize the wall's not moving, and now I have a concussion. Why do I say that? Physicians get burnt out by talking to people over and over and over again about smoking and knowing that they're not going to quit.
And coming up next, right here on the Heart of Innovation, we're going to hear Becca's thoughts as to the gaps in the conversations that are happening between the patients and the doctors and the patients on smoking cessation. That's coming up next. We're also going to get to the heart of how nicotine actually affects the blood vessels and some easy ways that might help you quit. But meantime, while we go to break, I'm going to Google poofing. Stay with us right here on KDOW.
Don't do it. Don't do it. Please. I promise you. It's disturbing. The fact that people figure out how to get smoke into their rectum is disturbing.
That's what I thought it was.
Yeah.
I've heard of this, and I don't even want to think about it. So yeah, Kim, leave it alone. Let's move on.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here.
Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for.
Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Hey everyone, welcome back to the show. We have Dr. Farrugia here. We're talking about the importance of quitting smoking. This is important for everyone because it's not just about cigarettes. It's also about, cannabis, vaping, all of the above, even if it comes to like nicotine patches, gum. What we're going to say over the next hour is really going to shock you. And before we get into the basic level about how nicotine actually affects blood vessels and more, which is so fascinating. Becca, is one of two. Becca and Douglas actually run our smoking cessation program on Monday nights through the Global PAD Association. Becca, what are you hearing about the gaps in conversations between the physician and the patients, where the patients just are not really getting the message, the importance of quitting?
Yeah, well, I can absolutely support what Dr. Farrugia said with the doctors just don't have time. I've had a couple of patients tell me, well, gosh, my doctor didn't say to quit. And, there's a couple different factors in that. Typically, I believe the doctors do, but it's what do they want to hear, that kind of thing. But I know working as a nurse in the hospital and outpatient facilities, I know the doctors don't have time. And that's where, as a nurse, we would step in a lot of times. The most important thing is just get the patient referrals, whether it's a flyer in the office, whether it's little cards they could grab, something, for a resource like our group.
Fantastic. And, I did have a patient. It's interesting that you said it. Sometimes they do want to hear just what they want to hear. We had a patient just recently in Arizona where he was on deck for amputation. We actually were able to save his leg. But the reason he never called his doctor and instead went to the emergency room is because 5 years ago, the doctor told him if he didn't quit, that he would lose his leg. And so that's why he went to the emergency room. It was 5 years later, and he thought he needed to lose his leg. Now, if he continues, there are very few Hail Mary options left. But it was interesting that he never told his wife that the doctor said it. So she
Yeah.
didn't see a problem with his smoking. So, I'm sure Dr. Farrugia, you see that type of thing, all the time.
It's
Everyone,
shocking.
they seem to argue for their own limitations. It's an addiction.
It's an addiction. It says it on the side of the box. Let's be honest, okay? It says it on the side of the box. So you can't say, well, they didn't tell me. It's trying to push blame away as opposed to taking full ownership of what this is. And it's an addiction. There's no doubt about it. It's the most addictive drug available, I argue, next to food that's available out there. Okay. The only difference between food and nicotine is you actually need to eat to live. Right. But it's so easy to fall back and to start making excuses as to why I need this. Oh, I'm just going to have one. Right.
Yep.
And I love talking to the people who will say, Doc, I'm down from a full pack. I only smoke 5 cigarettes a day now. Listen, that's a big move for someone who's been smoking for 20 or 30 years. I understand it. But I always retort with this. That's great. I used to do a full 8 ball of cocaine. Now I just do 1 bump in the morning to wake up.
Yep.
Okay. And everybody and all my patients look at me like I've got 2 heads, but it's the truth. No matter what, even with those 5 cigarettes, you are still increasing your in the moment risk of having a cardiovascular event and still prolonging the issues that are resulting in long-term damage to arteries all over your body.
I wanted to add to that, and Becca knows this, I know this, and I'm sure you do, doctor. When you're trying to get somebody to stop beating their head against the wall when they're addicted to something, it can be hard to do. So if I'm diagnosed with PAD and I walk out the door, I'm nervous, I'm scared, and the first thing I've been doing for the last 30 years is lighting a cigarette. That's
Right.
what I want to do. And it's hard when you're in that addiction to say, okay, that's enough. Because we get used to beating our heads against the wall sometimes.
Right.
Let's get to the basic level of how does nicotine actually affect the blood vessels and the blood flow? What actually happens in the
So
arteries every time someone smokes a cigarette, vapes, or uses cannabis
So
through
what
smoking?
everyone has to recognize is no matter how you're getting it in, nicotine is activating certain things all over your body, right? It's activating pleasure centers in your brain. That's why you get this sudden jolt of, ooh, that feels great, and you feel alive, and you have all this rush of energy, right? The problem is it's also activating your blood vessels all over your body, causing them to constrict or get smaller. What does that mean? That means that you're increasing the pressure on the heart that the heart has to pump against. So in the fraction of a second after your first inhalation, you are increasing your blood pressure. You're increasing the shear stress, meaning the way that the blood is moving through all of your arteries. That is going to now increase on very microscopic levels damage to the arterial wall. Okay, that damage to the arterial wall is what results in the formation of plaque, the medical term being arteriosclerosis. And that can happen both in the arteries that supply your heart, again, the arteries that supply your brain, the arteries all over your body, right? On top of the damage to the arteries, it's also resulting in damage to your platelets. Okay, what is that important? So the easiest way to explain it is it's making your platelets act to be a little bit more clumpy or more likely to form a clot together. That can happen on the microscopic level, or it can be very large, resulting in a heart attack or a stroke or damage to one of your internal organs besides the brain and the heart. Okay, on top of both of those things, recognize that when you're smoking, you're also inhaling carbon monoxide. So in that moment, you are causing the uncoupling of oxygen from all of your red blood cells. So now the carbon monoxide has a higher affinity for hemoglobin. So you're decreasing the delivery of oxygen to the tissues all over your body. Why is that a problem? Well, if you already have blockages, so you have decreased flow going to your extremities, to your brain, to your heart, and now you're supplanting oxygen with carbon monoxide, you're doing that much more damage to the tissues all over your body.
And that's with the first cigarette to the 10th cigarette to the 15th to the last one in the pack, isn't it?
That's because you get this meteoric rise in a superphysiologic dose of nicotine that creates all of these things in a burst-like fashion, right? It's the same. It's this again. It's easy to explain it using cocaine as an understanding. In the minute that you smoke, in the minute that you take anything in, your minute increase in risk for an acute heart attack, a stroke, or a thrombosis somewhere goes through the roof and then comes down because that's rapidly being reduced in your body, right? But that's the minute risk. The long-term risk that you set yourself on, if this continues to be a habit, and again, everybody that we're talking to today, this is not just a habit at this point. This is now a huge long-term problem that's going to cause all sorts of other damage. And we'll come back and talk about it soon.
Sounds good. Thanks so much. Thanks for teeing that up. Dr. Farrugia coming up next right here on the Heart of Innovation on KDOW. We're going to talk about the importance of making sure you do quit smoking before you have a little roto-rooting done on your arteries. We're also going to talk about the major arteries that smoking does impact the most. So stay with us right here on the Heart of Innovation. Don't go away.
Your type of condition is called critical limb ischemia. It's the most advanced form of PAD or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to PAD and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with PAD.
And all I heard was, "What are we doing here? Just cut it off." And I pulled the curtain back like, "Are you kidding me?"
Do you really want to go through all that?
That's crazy. That's insane.
The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options. We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Hey everyone, welcome back to the show. We have Dr. Peter Farrugia. We're talking about the importance of quitting smoking. We all know smoking is bad for us, but sometimes we need a little bit more greater understanding of the mechanism of action by which smoking actually damages arteries, and I think it's really, really helpful. It's also helpful to know, Dr. Farrugia, which arteries specifically does smoking seem to impact the most? We know the heart, we know the carotids, but in the legs, what could lead to amputation?
So that's an interesting way to put it. So amputation risk usually climbs sky high with blockages in the arteries below your knee. So the tibial vessels, you have an anterior and posterior tibial and a peroneal artery, which run the length of the calf down to the foot and ankle. Okay. Classically, when we talk about the damage of smoking on arteries in your legs, we usually start at the abdominal aorta, where your risk for aneurysm goes significantly up if you've ever touched a cigarette, right? So the current guidelines suggest even if for any man over the age of 65 who's even touched a cigarette in his life should get a screening ultrasound. I apply that same thinking to women just because the studies have not caught up with all the data that we have. But we're talking about specifically about lower extremity PAD or disease of the arteries in your legs. Then we're looking at really the majority of people will start to develop blockages in the artery in their thigh, which is that SFA, and the artery behind your knee, which is the popliteal. Your severe risk for chronic critical limb ischemia or CLI, and then non-healing ulcerations, that usually comes with severe damage to the arteries below your knee. Okay, so that's what we're looking for. That's why we're checking pulses and monitoring patients as we progress.
So I was diagnosed with PAD, but I also now have heart disease and atypical. So the combination have had the smoking. How does it go from PAD to the others where you can have an aneurysm or you end up with heart disease and all these other things from that smoking?
So you need to understand that it's not PAD leading to coronary disease. It's the data is very significant. Up to 2/3 of patients with peripheral arterial disease have concomitant coronary disease. The reverse isn't true, which is kind of interesting. It's actually less than 1/3 of patients with coronary disease have peripheral arterial disease. But smoking is at the core of all of it.
Becca, you have a question as well coming in from a patient.
Yes, correct. Okay, if doctor, if someone continues smoking After a vascular or cardiac procedure, how does that affect the outcomes and durability of the repair?
It affects everything from healing from the site that we go in to the vasoreactivity, or how those vessels are going to react after an intervention is performed, right? If we're dealing with coronary disease, where we at this point we're putting stents in, if that's what's indicated, by smoking, you're increasing the probability of an acute clot or thrombosis forming inside of those stents, resulting in acute heart attack, because it's affecting platelets. Okay. If we're dealing in the periphery, well, we don't always leave metal behind. We actually do our best to not stent every lesion. Okay. But that's still going to cause an increase in damage to the walls, in shear stress on the arteries that we just worked hard to open up, and increase the minute-to-minute risk of forming a clot down in the leg. So the risk is super high, to the point where I've told patients, if I smell smoke on you the morning of the procedure, I am stopping the procedure, because my job first and foremost is to do no harm. And if my procedure, which I'm doing to help you, is going to really increase your risk of acutely losing your foot, I'm not going to do it. It's too dangerous.
How long should a patient wait to have a procedure if they need a procedure? I mean, there are a lot of factors, right? If they have a real limb-threatening wound and life-threatening wound, they may not have a couple of weeks, but I was told anywhere between 7 and 14 days, 1 to 2 weeks, prior to a procedure, you should make sure that you have quit.
I completely agree. The problem is, it just doesn't happen. Patients are their own worst enemy. Okay. And it even to me, and this is how I think, and this is not how everybody thinks. Even if you switch from one crutch, which is smoking, to the gum, the patch, or the pill, you're still getting nicotine into your bloodstream. And that in and of itself is so harmful to everything that I'm trying to fix for you.
Can I add one real thing here, real quick? And that's what we experience, doctor, every Monday night when we try and convince people that either they're on their way to a procedure or they've had it done, stop smoking. And that insanity of trying to get them to understand the importance that you've just now had a procedure that saved your leg. Stop smoking, because you just took 10 steps forward, but you lit a cigarette and now you're 2 steps back.
Yeah. And I would argue it's more than that. I tell people all the time, listen, you had a massive heart attack 3 years ago. I just opened up this blockage in your leg, which is going to allow you to walk normally again. What more of a sign from God do you need that you need to stop smoking?
Pamela, you have a question coming in because we're talking about cigarettes, but you have a question. What about cannabis? Go ahead.
I'm just curious because if you take the flower and heat it, it turns to THCA. And I'm wondering how that affects your body.
So the data is kind of interesting. It's been shown that long-term THC use and abuse actually has significant side effects on your coronary bed. It increases your vasoreactivity. It increases myocardial oxygen demand, meaning that your heart muscle needs more oxygen. And at the same time, you're breathing in something that's decreasing or decoupling oxygen bound to your hemoglobin. And you're increasing stress on your heart, you're increasing stress on your arteries long term, which will have the same impact that we're seeing with nicotine. Now, there are a lot of observational studies that are out there, and they're still collecting data because it's becoming so much more normalized today.
With Pamela, are you talking about actually smoking it, or are you talking about like heating it in tea?
No, like actually smoking it. You're
Okay.
not getting nicotine, but you're just getting the cannabis itself.
Right. And then that's where when you burn something, when you actually burn it and it goes straight into your lungs and it picks up into your arteries, that's where it's like something that's foreign, it becomes toxic to your body. Is that right, Dr. Farrugia?
Yeah, again, that so it's I again where I come at this from is not from a lung standpoint, and that is damaging your alveoli, which are the small sacs in your lungs, right? So breathing in superheated fumes is going to damage your lungs. I'm not a lung doctor. That's not what I do. I'm a cardiovascular specialist. So the long-term effects of THC, of activated THC on your heart are very significant. And it's been shown over several observational studies that it does damage long term.
Well, coming up next, right here on the Heart of Innovation, we're going to talk about pain and smoking and pain and that vicious cycle. And we're also, stay tuned, we're going to have some great tips on how to quit cold turkey. So don't go away. Stay with us right here on KDOW.
If you smoke or ever did before, cigarettes, vapes, or something more, your arteries might be hurt inside. It's time to get them checked. Don't let problems hide. Check those arteries. Don't wait till it's too late. Smoking damages blood flow. That's just straight. Leg pain, cramping might be your only sign. Call the Leg Saver hotline. Get help in time. When you breathe in smoke of any kind, burnt material leaves your lungs in a bind, enters your bloodstream, makes it thick and slow, builds up plaque where blood should freely flow. Hip pain, leg cramps, don't ignore either sign. Could be blocked arteries that lead you to whine. Don't worry, ask your doctor for a simple test. PAD screening puts your mind at rest. 1833 PAD Legs. Get the help you need. Don't second guess. Stay on your feet. It's your life at stake. Call the Leg Saver hotline for goodness sake.
Hey everyone, welcome back. We're talking to Dr. Peter Farrugia about quitting smoking, the mechanism of action by which nicotine and even cannabis, if you smoke it, are actually causing damage to your arteries, leading to stroke, cardiovascular, heart attacks, and amputation in your legs. Douglas, I know that Dr. Farrugia has been talking a lot about the patches and such, and you do have a question that has come in about that from a patient. Go ahead.
Yes, ma'am. We deal with that a lot on Monday nights, that we want to quit smoking, so we're told to get the patches, try the little cigarettes and the little things you can buy now that light up, that are not supposed to have nicotine, and all the things that are on the market now. Are you still receiving and getting the nicotine? It's just not in the levels, but it's still doing the damage.
1,000%, you are still doing damage. When I talk to people about quitting smoking, the nicotine replacement therapies that are available out there, none of them are good. It's replacing one crush with another. And no matter what, no matter how you get, I said it before, I'll say it again, no matter how you get nicotine into your system, it's doing damage to your body. There's no doubt about it.
Okay. And so you are not suggesting that they should be on long term, just because some people have said, hey, you know what? I'm not smoking, but it's just low doses. I just, keep chewing the gum or putting on the patch.
I told you this when we met over the weekend. If they really want low doses of nicotine, go eat an eggplant, go eat a tomato, right? There are very low doses of nicotine in every nightshade vegetable that's out there. Those are more physiologic doses of nicotine, as opposed to what you're getting from smoking or any of the replacement therapies, right? The reason why all the damage is done with smoking, with chewing, with the patch, with the pill, with whatever, is you're getting supra physiologic doses straight into your bloodstream. Okay, that's what's doing all that damage. The doses are way too high, which is why you cannot go from one to another. You're just replacing one crutch with something else, and the probability of you slipping back into smoking is way too high.
I was curious how that affects the pain levels and how we go with that, because if I've had a procedure and I'm still smoking, I'm still hurting, I can't walk. What is the combination there in trying to quit and getting to that point of stopping?
Smoking in that standpoint is going to hurt you in several ways, right? As I said before, it's going to increase the constriction on your distal blood vessels. And if you're already hurting from walking, meaning you're either a significant claudican or you're having some level of rest pain, then it's making those blockages worse, right? The nicotine actually does a couple of things on top of just constricting blood vessels. As I said before, it works on your platelets. Not only does it increase their capacity to clump together or form a clot, it actually decreases their production of nitric oxide. Nitric oxide is a vasodilator. Okay, it also helps prevent those platelets from clumping together. Okay, the last part of it is you're getting pain with PAD because the muscle tissue in your legs is not getting enough oxygen. As I said before, when you smoke, carbon monoxide is now replacing oxygen in the hemoglobin of your red blood cells. So now you're decreasing the amount of oxygen that's being delivered to your distal tissues if it's getting through the blockages in those arteries. So you're doing 3 levels of damage to worsen your pain.
Well, doctor, we've had this question by a few patients before in our meetings is individuals that have chronic pain. Even some of it may be directly from the pads, some of it may be, other in their back, their neck, and all that. And what they've explained is that it creates that vicious cycle. They cannot, the smoking, it temporarily, like on an immediate level, it reduces that pain. So they have to keep smoking. Can you explain how that affects the chronic pain cycle?
So it's like anything else. This is why chronic pain management specialists have moved to methadone or other very long-acting medications that don't have this peak and trough effect, right? When you smoke, it activates your pleasure center. Absolutely. That's why you feel so wonderful. Probably helps those chronic pain patients get rid of, or at least feel like they are out of pain in the temporary moment. But how long does nicotine last in your system? That's why they start crashing. And as they're crashing, their pain comes back. And a lot of times it almost rebounds, right? So their pain levels are getting higher than they were before because of everything that I've already explained in terms of now we're decreasing oxygenation all over the body. Whatever their source of pain is, nicotine is going to help prevent healing, help prevent angiogenesis, which are all things that help from a healing perspective, depending on what it is that they are suffering with. So
is that like piling one cigarette on top of another cigarette on top of another cigarette, isn't it?
Right, that's exactly what they're doing to try and keep themselves out of pain, but it's not working. Because again, even if you were a chain smoker, at some point you have to stop to breathe. And that's when they will crash, and in that crashing, their pain will go through the roof again.
So what's the only way to solve this problem, doctor?
I believe in cold turkey. Okay, I know that I am a small percentage of the population, but I can tell you for 15 years of being an attending physician, the only people that I have seen that are continued to stay in remission are those that chose to go cold turkey, whether it be because they just woke up one day and said that's it, or they had a massive heart attack, or something bad happened to them. And I hate that that's what it takes to wake people up. The problem is, even when something bad happens, the majority of people still never actually wake up. And when we come back from break, I can tell you what I tell patients to do, and maybe it'll work for you, and maybe that will be a part of your success.
When your sugar runs high, it's more than a sign. Diabetes creeping in, it's a dangerous line. Pre-diabetes too, don't think it's too light. It can lead to PAT, so start the fight. Sugar's sweet, but the cost is real. High blood sugar makes your arteries feel clogged. Slow flow, it's a ticking time bomb. Catch it early, stay strong, and keep your legs on. Sugar's not so sweet when your leg is in pain. Not controlling sugar is where peripheral artery disease sets in. Got sugar? Get checked. Don't wait too late. Save your legs, save your life, take control of your fate. Leg pain, cold feet, neuropathy too. These are signs diabetes caught you. High sugar's the link where circulation and pain left untreated. Your leg might end in flame.
Hey everyone, welcome back. We're with Dr. Peter Farrugia, and he says he has a guaranteed way to get you to quit smoking. So, Dr. Farrugia, let's hear it.
Okay, here it is. This is very straightforward and honest. It takes 4 days. You give me 4 days, you do everything I tell you to do, we're going to win together. Go out, go to whatever big box store you shop at. Go get the small little 8-ounce waters, okay? Fill a backpack. That backpack now becomes a part of you for the next 4 days. Every time you get an urge, you take the backpack down, you take a water out, you replace it. Backpack goes back on your back, and you have to drink a water. That water needs to stay to your lips for 3 minutes. Why 3 minutes? That's how long an urge lasts, okay? You do this every time you get an urge. Within the first day, you're going to feel ridiculous. You're going to say, why am I doing this? You're going to be bloated. You're going to have drank more water in 1 day than you have in 10 years. Okay? By day 2, your back starts hurting. You're peeing all the time. You're getting aggravated. You're like, why am I doing this? Okay? But this is where it works, because what we need to accomplish is change the positive reaction from an urge into negativity. You need to take your brain and switch it. And this takes 4 days, but you put the effort in, it will happen. By day 3, you're cursing at me in multiple languages. Your back is killing you. You feel ridiculous because why the hell am I holding a water to my mouth for 3 minutes straight? And day 3 is where the magic happens because you get so mad at yourself. Why am I doing this? What is this all about? Why do I need to do this ridiculous thing? And day 4 comes and you're still carrying that weight. That weight is there to remind you of all the bad decisions that you've made that are putting you in pain. You don't necessarily always feel, but right now in this moment you are. And that's when you make the subconscious decision to quit. And that's victory.
That's huge. And do you have a success story to share?
We do. I have at least 12 patients of my own who have done this and won.
Really?
Absolutely. All you have to do is actually believe and do it.
Wait, how did you come up with this?
You put everything together. Again, an urge lasts for 3 minutes. What are we doing when we say you have an urge? What's going on inside your body? Your subconscious has convinced itself. Putting that cigarette to my lips is consistent with a very positive rush of amazing feelings. Well, we need to change that subconscious feeling into when I get this urge, I feel I'm bloated. I have to pee. My back is killing me and I feel ridiculous. That's what needs to happen.
So should you milk that 8-ounce water bottle for the full 3 minutes that you set your timer for?
That bottle has to stay to your lips for 3 minutes, 1,000%. Because
so you just
you have an
slowly
oral
suck.
fixation. Remember, this is all part of it.
Wow. Well, thank you so much, Dr. Peter Farrugia. We really appreciate you. Interventional cardiologist out of Central New Jersey. Thank you so much. And if you want to join our smoking cessation group, make sure you go to thewaytomyheart.org/quit-smoking. Thanks for everyone for joining us.
Thank you.